Promoting resilience in the classroom through MindUP. Did you know that our brains develop exponentially in early childhood and keep changing until the age of 25? Taking a closer look at the brain, a child's emotional responses are controlled by the amygdala, and memories of the events that trigger those emotions lie within the hippocampus, both of which develop early on in life. However, the prefrontal cortex, which helps us think through and regulate our emotions, is under development until early adulthood. So it's not surprising then that children may struggle to deal with frustrations. Stress is a normal part of life, but in certain situations, it can become overwhelming and damaging. Traumatic experiences such as abuse, neglect, poverty, loss of a parent, or post-migration trauma are strongly linked with impaired brain development, specifically in the fear center of the brain, the amygdala. During particularly stressful events, the prefrontal cortex goes offline, inhibiting our ability to think clearly. Instead, the amygdala takes control and activates the stress response known as the fight, flight, or freeze. If the amygdala is triggered frequently for prolonged periods in childhood, it causes the stress response pathway in the brain to become more like a superhighway. This means the child's brain can easily and quickly react to situations that are reminiscent of previous traumatic experiences, even in the absence of real danger. You could think of children's stress response system in this high alert survival mode as a car whose engine is constantly revving. The car is always ready to race off with a stress response, but this state is also causing a lot of long-lasting wear and tear on the engine. Children with highly activated stress responses are at risk for difficulties in decision-making, self-regulation, memory, and stress management. These are important skills for success in the classroom. It's important to note that children who have experienced traumatic events are not destined to be problematic in the classroom or always challenged in school. Lots can be done to buffer against traumatic stress, including seeking mental health professional help, having strong relationships with a caring adult, spending time in nature, practicing meditation, exercising, and learning social, emotional, and life skills. We want to tell you about a school-based program that involves many of these protective factors. MindUP is a universal, mindfulness-based social emotional learning program for children in pre-kindergarten to grade 8 that integrates neuroscience, social emotional learning, positive psychology, and mindful awareness. Through 15 teacher-led lessons, MindUP teaches students about the brain, mindful exercises, and self-regulation strategies to cultivate self-awareness, stress management skills, optimism, gratitude, and empathy. For our intervention, we paired MindUP with trauma-informed practices because the strategies learned through MindUP are helpful for all children, but especially beneficial to children who have experienced adversity. To implement and evaluate the effectiveness of the MindUP program in a trauma-informed framework, the Center for School Mental Health at Western University partnered with the London District Catholic School Board. Between 2016 and 2020, we recruited over 1,000 students in kindergarten to grade 3 from 15 intervention schools and 7 comparison schools. The intervention educators received trauma-informed training and MindUP training and support and implemented MindUP in their classrooms. Students at MindUP schools demonstrated improvements in executive functioning, such as problem solving, adaptive skills, such as communication skills, and reduction in behavioral symptoms, more so than peers in comparison schools who did not receive MindUP. Furthermore, educators also reported benefiting from the intervention. After participating in trauma-informed training and teaching the MindUP program, educators reported reduced burnout and increased levels of personal accomplishment, self-efficacy, and self-care. The training also helped educators realize that self-regulation starts with them. As role models in the classroom, when educators demonstrate calmness, establish positive relationships, and foster a safe environment, the child is better able to connect with their prefrontal cortex. Educators who practice co-regulation with their students are laying the foundation for healthy self-regulation. In an educator's own words, "I still remember from the trauma workshop, why this child, why now? I say that to myself when I have a child that's misbehaving or being attention-seeking. The results from this study suggest that mindfulness-based social-emotional learning interventions like MindUP and trauma-informed training for educators can benefit educators and may improve the social, emotional, and behavioral outcomes for young children in their early years of school. For more information about our MindUP research and to view our published findings, please go to Western University's Center for School Mental Health website.